Hi, it's just another information video on the RF needling device that you've purchased from Derma Group. Now, we have a lot of clients that get slightly concerned with reactions that happen after treating a patient. And I just want to clarify what is normal and what we would advise when obviously doing consultation. If you're unsure and you're unsure of how your client's going to react, we would always advise doing a patch test. If it means just doing a one square patch test with the device while they're filling out the consultation form prior to the treatment, that's going to allow you 15 to 20 minutes just to see how the client is going to react. What we advise and you will receive in training is certain perimeters and power levels subject to the skin Fitzpatrick scale. So clients that have skin types 1 and 2 or 5 and 6 tend to be more sensitive and react differently to RF needling. And what it means is that they may be left with track marks. What we found is that when you're starting to do the first treatment and moving forward, you will go up in increments. So if you started your power level at 40 for skin levels, say 3 and 4, what we advise is to drop that power level down to 30. So if you were doing skin levels 1, 2, 5 and 6, you would start your power level, which is the heat level, at 30, and you will go up in increments of 20. If you were going to be doing skin types 4 and 5, then you will start at 40. It doesn't mean that skin types 4 and 5 aren't going to react, but it just tends to be that those skin types tend to heal a lot quicker and have less reaction. If you are going to do skin levels 1 and 2, it is completely normal for clients to become red and inflamed. What you are doing is you are creating trauma. We are wanting the body to react to that. So the reaction is completely normal. It is normal for the client to be red, maybe for the whole of that day, and you will find that within the evening time and the next morning that the skin's completely calmed down. There are really rare cases where you will have clients that are left with slight track marks. This is obviously, we try to avoid this by dropping the power level down, but as you can understand, each patient is different. They react differently. They may have been on past or present medications that are still safe to use with RF, but it could just obviously mean that the skin's going to react differently. It is completely normal. Never have we had clients obviously scarred or left with anything from RF, but I just want to reassure you that if ever you did have a client that is left with track marks, that obviously it's normal and that it just might take a lot longer for it to heal. There are things that we could advise to use. So there are obviously things like bio oils or Elizabeth Arden 8-hour cream is something that allows the skin to heal quicker, that you could advise your client to use to obviously heal the skin and the track marks with obviously disperse a lot quicker. But obviously we don't want you to panic. So any kind of redness, inflammation, slight track marks, or obviously people that are left with track marks, they are going to go. And I think it's really good that from this education video that you can then educate the client and understand the process of RF needling and how each client is completely different. Obviously when you do RF needling and you're doing one pass, which is the normal thing that we will stipulate in protocols for just a normal treatment, one pass is not really going to produce much redness or blood spots. But what you will find is if you have clients that have problematic areas, say they have severe acne on the cheek area, then if you are going to be doing multiple passes, then like microneedling, it is going to produce obviously inflammation and it may produce blood. Again, that is completely normal. Obviously with microneedling, it's all about causing trauma and scratching the skin, and it can be quite traumatic. Whereas obviously with RF, it is all about being that little bit calmer and kinder to the skin, but again creating that high amount of trauma to get the reaction for the skin to heal and produce all the collagen, fibroblasts and elastin that we're needing to obviously repair the area that we're treating. So if you are obviously going to go over multiple times, it is completely normal to obviously get an excessive amount of blood. The other thing that can be completely normal is bruising. Obviously what you have to understand is that when we're dealing with the face, we're dealing with suction, and suction on some clients can create bruising. So I would always advise all of this in your consultation. Always be transparent and always educate your client that redness, inflammation, possible track marks being left, bruising, bleeding is all normal within this treatment, and for your client not to panic, and that if they are concerned, obviously to contact yourself, but you are already educated to know what is normal and what isn't. Thank you for taking your time to watch this video, and hope it's helped on understanding obviously the after effects of RF treatments.